Hello, this is Dr. Firnhaber, and it's time for another 10 minutes of truth here on Wednesday. So I've got another article for you today, as usual, and this article is out of the Journal of the American Medical Association, July 3rd of this year. So it's still very recent. Very, very powerful article, and there's information here that all of you need. The name of the article is called Low-Dose Aspirin and the Risk of Stroke and Intracerebral Bleeding in Healthy Older People, Secondary Analysis of a Randomized Clinical Trial. So this was a double-blind, randomized, placebo-controlled study, which is the gold standard in healthcare. There were about 9,500 people in each arm of the study. So let's just start out. What was the study about? Well, low-dose aspirin has been widely used for primary and secondary prevention of stroke. The balance between the potential reduction of ischemic stroke events and increased intracranial bleeding has not been established in older adults. So what they're saying here is that an ischemic stroke is one where there's a loss of blood to the brain. Usually it could be due to a clot, usually. And so they're saying there's a balance here between preventing that kind of a stroke, but promoting brain bleeds. So let's look at the key points from this study. Aspirin is an antiplatelet agent that has been used in low doses for prevention of cardiovascular events. Despite some recent unfavorable findings, it continues to be widely used for primary and secondary prevention of stroke. Its major adverse effect is increased bleeding tendencies. Study on the efficacy of low-dose aspirin on populations younger than 70 suggests a trend towards reduced ischemic stroke counterbalanced by increased intracerebral and other intracranial hemorrhage with little overall impact on total stroke incidence. So basically they're saying that it really doesn't work very well. So the findings in this study is aspirin did not produce a statistically significant reduction in the increase of ischemic stroke. Subdural hematoma or subarachnoid hemorrhage, whether occurring spontaneously or as a result of trauma, were more common among individuals receiving aspirin. Major extracranial hemorrhage, including upper GI bleeding, was increased in the aspirin group by 87% as compared to the placebo group. Among individualized randomized to the aspirin, meaning that was the group of the study that was taking the aspirin, there were additional cases of intracerebral, subdural, and extradural hemorrhage, some occurring after trauma, and others occurring spontaneously. A statistically significant increase in intracranial bleeding was observed among individuals assigned to aspirin compared to those assigned to the placebo. So the conclusions of this study, a significant 38% increase in intracranial bleeding resulting from a combination of hemorrhagic stroke and other causes of intracerebral hemorrhage among individuals randomized to aspirin. So, this study was done in individuals 70 and older. So basically what this is saying is that if you're 70 or older and you take aspirin to prevent a stroke or heart disease, your chances of having an intracranial hemorrhage, just a spontaneous brain bleed, are really a lot higher than your chances of having a stroke if you're taking aspirin. So what does that tell you? It's not good. It's not good to take aspirin to prevent strokes. Not good at all. And here's just another damning study on the side effects of medication that needed to be done, that shows all these older people, all these years taking aspirin to prevent stroke, were actually hurting themselves rather than preventing stroke. What else did the conclusion say? In this secondary analysis of a randomized clinical trial of older adults, there is no statistically significant benefit from aspirin in preventing stroke or any conventional stroke etiological subtype. These findings suggest that low-dose aspirin may have no role for the primary prevention of stroke, and that caution should be taken with the use of aspirin in older persons prone to head trauma. So the fact of the matter is that older people who are prone to falls and hitting their head will have a much greater risk of a bleed out if they take low-dose aspirin. So I would say this: avoid it. Avoid low-dose aspirin. Avoid it if you're older. Avoid it if you're younger. If you're taking aspirin for pain, don't take it for very long. I'm not saying you should never take it for pain or for other things, but I wouldn't take it very long. But to take it for prevention of stroke if you're older, you're going to cause yourself more harm than good. And this is a study right out of one of the most conservative medical journals in the world, Journal of the American Medical Association. So I hope I've scared all of you, or this article has scared all of you into not taking aspirin to prevent heart disease or stroke. And I will have another study for you, another 10 minutes of truth next week. All of you stay safe this week, stay healthy, and I will see you next week.